Okay, today I'm going to be demonstrating dry needling technique to assist with pain in your wrist and hand, which can be related to carpal tunnel syndrome, quervain, tenosynovitis, arthritic pain, and just general achiness and pains that you may have in your hands for various reasons. So I'm going to start with using these 15mm needles, and the first site of insertion is going to be over her carpal tunnel. Avoiding any of the obvious superficial vasculature that you can see. All right. Next insertion point, common with people with thumb pain, we're going to insert into this mass over her thenar eminence. Good. Then you're going to very carefully assist your patient in turning their hand this way. And from here, we're going to insert 2 more needles. One is going to be into this web space in between her fingers where there is commonly trigger points. You're going to go until you won't feel bone here, but typically you're going to go until you feel bone, epiphyseal tissue, or tight muscle bands. And then we're going to use another 15mm needle to insert over her carpi, extensor carpi radialis. Good. Okay? Mm-hmm. Okay. So now typically with this form of treatment, we will also be inserting needles further up the chain along the distribution of the median nerve, which is commonly what is entrapped in carpal tunnel syndrome. So for that, when we move up into more of the bulk of the forearm, we need to use a little bit of a longer needle. So here I'm going to be using a 40mm needle. And we're going to find her medial epicondyle, and we're going to come just distal to it, avoiding the major vasculature in the center of her forearm. Good. And then I would also be setting up some needles into her cervical spine at the level of innervation and nerve roots that supplies the wrist and hand, depending on what we're treating this patient for, and we could even connect electrical stim to it as well.